The other thing is, of course, the monitoring. Is it working? How long is it going to work for? You know, they don't, unfortunately, people need a change in therapy, of course, and exactly that timing is, you know, quite variable, and different factors go into it. But if somebody has already received a refill and their disease has progressed, again, that's another area of waste, you know.
Right.
And the integrated medical pharmacy team can look at scans, you know, can look at scan results, can look at markers, you know, for example, right?
Yes, and we do that. So again, whether it's breast cancer or prostate, you know, based on the indication and based on the package insert and information that you glean from journals, how sort of like what that expectation might be for a patient that starts the therapy. But as you mentioned, that's one thing to keep in mind, but then obviously you go right to the EMR and you see when a scan is coming, or you see the markers, and you make a determination that, you know, things may not be looking like they're going well, and we may need to make either a holiday due to side effects or switch therapies. And the medically integrated team at the practice does do that, again, taking waste and cost off the table and doing what's right for the patient, at the same time doing what's right for the payer.
Incredible. The savings strike me as enormous, and I'm just even thinking with IVs, with the use of, like, you know, hematopoietic growth factors, for example. You know, pharmacists are experts, you know, at these things, and they can see the patterns. The practices are very busy, you know, with the nurses and the physicians are very, very busy, you know. And of course, we obviously do the best we can, but there's always fine tuning that can be done, you know, et cetera. So I can see the cost savings on this amazingly, actually, you know.
Yes.
We should do more and more of this, obviously, because can you speak a little bit about how the integrated pharmacy team might be able to help patients with access? I know it's a complex area with copays, you know, copay cards, some vouchers, foundations. It's quite complicated. It's a lot of practice resources to track all of this. Does the integrated medical team get involved with this too?
Yeah, absolutely. And so one of the best practices that we had at the practice that I was at, and what I've seen at several Encoda practices, is developing a process flow. So it starts with a prescriber initiating a prescription, and then they ultimately ending or culminating in the dispensing of that prescription. And all the folks in between, internal and external stakeholders that interact with that prescription, so to speak, from concept or writing the prescription electronically, certainly, to the dispense. And what does that look like, and who touches that prescription per se, and how that affects the outcome at the dispense. With the idea that when you do have the opportunity to dispense an oral oncolytic to a patient, that you minimize or eliminate every single surprise, right? So we talked about education prior, but also the financial toxicities, which we've mentioned. When our patients come to the window, per se, to pick up their prescription, they already know that they had a copay of, let's say, $800, yet our medically integrated team, based on training and based on our mission, have looked for foundation support, or maybe a copay card if they're a commercial insured patient. And so we've scoured and looked under every rock possible for financial assistance to eliminate the financial toxicities that are associated with oral oncolytics. I mean, there's plenty of studies that show the adherence and how it diminishes when copay or the copay obligations go up, right?
Yeah.
And so there's
barriers, complete barriers. I mean, like no go, basically. You know?
Exactly. And so what we've done across the Encoda network is we've emphasized the importance of folks on this team, part of this process, right? The oral oncology nurse or the pharmacy tech or the pharmacist within that space, looking for financial assistance. And then what we do is we track that financial assistance. So at the end of the month or the end of a quarter or a year, we know how many millions of dollars we've supported our patients to help them be eligible to try to eliminate the financial toxicities so that they can start a life-enhancing or life-extending therapy.
Yeah, that's really really good because it's complicated. And to have that really centered with one team is really great. Plus the fact the patient knows who to call.
Exactly.
Because they can call the nurse navigator if they run into trouble, if their financial situation changes or insurance changes or what have you. So that get in front of that, so they're not going to be without their therapy.
Exactly.
Boy, there's an amazing number of advantages here. Can you explain to me a little about this this QPI and what it is? Why is it important? Is it are these things getting more mandatory as things go on? How does that relate to the integrated medical pharmacy team?
Yeah, so a positive quality intervention, or PQI, is an acronym of one of our 4 quality standards. Again, there's 4 domains within our quality standards, foundational being the first, patient-centered being the second, positive quality intervention being the third, and then health information technology. And really, as I mentioned earlier, the quality standards is a roadmap or a framework for practices to be more medically integrated when we're referring to oral oncolytics. And positive quality intervention, quite simply, is a concise formula or stepwise procedure. The positive quality intervention is a quality standard that is a education and communication platform. There's 2 elements to the PQI, education and communication. And what we're doing is we're trying to educate in a concise format all of the individuals, all the internal stakeholders that are responsible for patients receiving oral therapies. And the organization NCODA has developed close to 20 positive quality interventions, and we're working on more. We have a committee that works on these positive quality interventions. And again, it's an education and a communication platform to help elevate the standard of care within the medically integrated pharmacy team.
Like what kind of examples, for example?
One of the first examples for a positive quality intervention was about 4 years ago when the first CDK4/6 inhibitor was approved. When a pharmacist within the medically integrated team receives a prescription for an AI, so to speak, they may ask themselves a question. They may say, well, is this patient eligible for a CDK4/6 inhibitor? Because they know that one was just approved a week ago or a month ago, relatively new to the market. And let's assume everybody within the care team, because there's so much going on within the practice, and if you're in a practice where you don't have specialists that just treat breast cancer as an example, they may not be aware that a week ago this new life-enhancing, life-extending therapy was approved. So practices will take the time, utilizing the electronic medical records, say, hey, is this patient ER/PR positive? Are they HER2 negative? Are they metastatic? Do they hit these kind of criteria? And so we've documented those bullet items, real simplistic, saying, again, this goes back 4 years ago, but that was the first PQI where the light bulb went off, and we said to ourselves, it's incumbent upon us to not just fill the AI, because you can do that. You could fill the aromatase inhibitor prescription, and the patient is on their way. But it's really incumbent upon the medically integrated team to do one step further and just check and see, is this patient eligible for this or that? And they may not be eligible for the CK, then that's fine, right?
But never hurts to raise the question.
It does.
That's incredible, actually, with all it's one new drug per week that's approved. I mean, I could never be a general oncologist. I can barely keep up with breast cancer. I mean, it is a huge issue.
Right, and so that's why the importance of the quality standards of kind of elevating our game, the oral oncology nurse, the pharmacy tech, the financial counselor, the pharmacist, taking a look at all of the elements that makes the patient's journey on oral therapies better.